This is a case study of a known patient of cirrhosis of the liver, in which you are seeing the portal vein. This is the fluid around the liver. This is the outer surface of the liver, which is being seen smooth and shiny in this region. This is the liver parenchyma. This is the portal vein, and if you see that the portal vein is measuring 14.7 up to 13 is considered to be normal. So this is a dilated portal vein. This area, and this is the liver, whereas these are the dilated intrahepatic bile ducts. For that we are seeing in the right lobe of the liver. This is the kidney. This is the right kidney normal, and this is the liver parenchyma, and you can see clear fluid surrounding the outer surface of the liver. Mild irregularity can be seen in this region, that of the upper. Now, the intrahepatic bile ducts are seen dilated at all levels. There is no fluid seen in the right pleural space, no evidence of intrahepatic focal mycelium, and this is the left lobe of the liver, and the left lobe of the liver is significantly extending beyond the origin of the superior mesenteric artery from the aorta. Here you see. This is the superior mesenteric artery arising from the aorta, and this is the head of the pancreas. This is the portal vein, and we do not see any focal mycelium relating to the head of the pancreas. The left lobe of the liver is enlarged, seen extending beyond the origin of the superior mesenteric artery from the aorta, and thus this left lobe of the liver is enlarged, and the intrahepatic bile ducts can be seen dilated in this location as well, in this region as well. Here we are. Now these are all intrahepatic bile ducts, dilated intrahepatic bile ducts that are seen dilated at all levels, and moreover they reach the periphery of the liver. You can see that they reach the periphery of the liver. Now the pancreatic body is seen normal. This is the splenic vein, this is the splenic vein, this is the body of the pancreas, this is the aorta in transverse section, and so no pathology seen relating to the splenic vein. What's seen is, along with these dilated intrahepatic bile ducts, is that the gallbladder is distended significantly. You see, this is the longitudinal section of the gallbladder, with no calculus seen within its lumen, and no debris seen. This is a fold within the and ending into the gallbladder lumen, whereas this is the gallbladder fundus, the body, the neck region, and from the neck region onwards we cannot trace the CPD with that confidence. Now this is the liver, part of the liver that you are seeing in this particular location. Now you see that in transverse section the gallbladder measures approximately 5.2 centimeters in transverse section, And remember, more than 5 is considered to be dilated. So this is a dilated gallbladder, internally free of any calculi, debris or focal mass lesion, nothing is seen. So this is very much consistent with a distended gallbladder with dilated intrahepatic bile ducts. Now, obstructive jaundice is definitely there, no doubt about that. Where is the, can we get to the CBD or, yes, straight away I come across the portal vein at the neck region. This is the portal vein. It's very difficult to reach the CBD from this point, from this angle. Now you see, if I measure the gallbladder in longitudinal section, it measures 145 centimeters, sorry, 14.5 centimeters, and the kidney measures approximately 8.3 centimeters. So the length of the gallbladder is more as compared to that of the right kidney in longitudinal section, whereas normally it is said in some books that, and some literature, it is reported that the measurement of the gallbladder in length is less compared to that of the right kidney. So anyways, now this is the portion where we see the, I am magnifying the image. No calcification is seen in the dilated ducts. These are all dilated ducts, and these are all dilated ducts because I have magnified the view. That's the reason you are seeing them so dilated. No calcification seen, no mass is seen, focal lesions, sorry, within these dilated intrahepatic bile ducts. So even with patient in left lateral decubitus posture, it's not easy to get the common bile duct ascended. Now this is the same view that you were seeing with lower magnification, and this is with higher magnification, and an attempt to see that if there is any obstruction at the level of the cystic duct or common bile duct, but it's so difficult to, it's not easy in this case, particular case, to get to the CBD. So maybe there is a common bile duct stricture in the common bile duct. The possibility of that cannot be ruled out and can be a cause of the obstructive jaundice. Now this is the hepatic artery in transverse section. This is the portal vein. This is not the bile duct. Anyway, this is a cirrhotic liver with dilated intrahepatic bile duct surrounded by fluid, and distended gallbladder, CBD not clearly visualized, with you see that the relatively normal dimensions of the right lobe and the large left lobe of the liver, which extends beyond the region of the superior mesenteric artery from the aorta. Now this is the aorta, this is the superior mesenteric artery, and if I draw a line from here to here, and then you can see that how much of the liver is extending beyond the region of the superior mesenteric artery from the aorta. This is not normal. Normally the liver is seen, left lobe of the liver is seen, usually we see it posterior to the origin of this mesenteric artery. So there are no para-aortic lymph nodes. There is no evidence of portal vein thrombosis. Here you can see, and following the portal vein in the intrahepatic region, from here onwards it becomes difficult. So we do not see any lymph node or focal lesion at the region of the porta hepatis as it is. This is the region of the porta hepatis. I see the chordate lobe as normal. This is the chordate lobe or segment 1 of the liver. This is the ligament venosus, the left lobe of the liver in longitudinal section. And this is the transverse section of the left lobe of the liver. This is the spleen, and spleen layers from pole to pole. 11.8 up to 12 is normal, so spleen is not enlarged. Now there is significant amount of fluid, minimal to moderate amount of fluid seen in the peritoneal cavity. This is, and you can see the bowels floating in this ascitic fluid. This is the ascitic fluid. These are the bowels. This is the urinary bladder in longitudinal section. This is the prostate in transverse section. And as you can see the bowels floating in the ascitic fluid everywhere in the abdomen peritoneal cavity. Here we are. See the degree of dilation, that of the gallbladder. And from here, if you see, the neck becomes too narrow to be traced forward. So the possibility of CVD stricture cannot be ruled out in this case. And this is a case of obstructive jaundice, and I very much doubt if this is of benign nature. So this is our case of the day, which includes cirrhotic liver with enlarged left lobe of the liver, with dilated portal vein, mildly dilated portal vein, which is patent, and we see the dilation of the gallbladder and ascitic fluid surrounding the liver, as well as in the dependent region peritoneal cavity, in the abdomen, and intrahepatic bile duct obstruction is seen. And this is a case of obstructive jaundice as well, most probably because of some aggressive pathology which is beyond the scope of this ultrasound, especially when you are performing it with 2D ultrasound, with not with a Doppler, and do not have the facility of a Doppler. Thank you very much.